expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. The Center for Autism and Related Disorders advises working with a board-certified behavior analyst who has experience with autism before starting any intensive behavioral intervention. Any choices you make in determining your child's treatment are completely at your own.
Good morning and welcome to Autism Live. I'm Shannon Penrod and we are webcasting to you live from the Center for Autism and Related Disorders headquarters in Tarzana, California. Good morning and welcome. You know that I love Wednesday. Wednesday is a very exciting day because we usually have Dr. Doreen Granpeesheh here in the first hour for Ask Dr. Doreen. Now, I have some unfortunate news this morning because today we were scheduled to do the second half of the anxiety show. 2 weeks ago, right before Thanksgiving, the day before Thanksgiving, Dr. Doreen Granpeesheh did the first half of the anxiety show for you, where she talked a great deal about anxiety. We were both very frank about that, how it affects both parents and individuals who are on the spectrum, and outlining the difference in between OCD and anxiety and how this diagnosis has changed over the last couple of years, especially now with the DSM-5. And we were scheduled today to bring you the second half of the anxiety show where we get into the nitty-gritty of talking about how do we resolve these issues with our kids on the autism spectrum. Unfortunately, because Dr. Granpeesheh is a very busy woman and there are things that happen, she was called away for an emergency and is not able to be with us here this morning. And I know I can hear the groan of, oh no, I have been waiting for this. But here's what I can tell you. What we're going to do for this hour is replay the anxiety show for you. I know a lot of you said you missed it because you were traveling for Thanksgiving. So we're going to replay that, and I'm told that we're going to be able to give you the second half of the anxiety show next Wednesday. So in just a few minutes, we're going to replay that first episode of the anxiety show, but it doesn't stop the holiday giveaway extravaganza from continuing on, and it won't stop us from doing Let's Talk Autism with Shannon and Nancy in the second hour, and our special guest, Susan Campbell Cross from Fit Magazine, a lifestyle editor for Fit Magazine, is going to be here and give us the 5 tips for having a successful, stress-free, joyous holiday season. So, and to get through the winter break, more to the point, this period of time where a lot of us have less services, more time with our kids, which is, you know, supposed to be happy and joyous, but if they've got less structure, you know, it's like the sweater that can unravel. So Susan's going to be here to help us sort through all of that and have that winter break be really wonderful, relaxing, productive. Can't wait for that. But as I said, we're continuing with the holiday giveaway extravaganza. In this first hour, we have 2, count them, 2 huge things that we're giving away. We are giving away another skills subscription for one child for 6 months. We have one of those to give away. It's the last one of the year for us to give away. So we're going to be giving away that during this hour. And we're also going to be giving away IBT, the Institute for Behavioral Training, has put together these packages of training that are for holiday survival. And so we're going to be giving away one of those packages. I think it's 4 or 5 different trainings that are great for a parent or to share with a family. If you've got relatives coming to stay and you want to bring them up to speed on how we're going to make this work over the holidays, these were specifically made to survive holiday get-together and concerns. So we're going to be giving away one of those and a skills 6-month subscription for one child. We have one of each one of those things, and we're going to give them away to different people. How can you win it? Well, as you watch during this hour, email that to us, and Emily's going to show you the address that you email it to, and you must email it skills, or you want the IBT Holiday Survival Kit tomorrow, and then tomorrow about Lego and how and all kinds of things that you can as a base plate so that they can build on it. But this is an awesome, awesome toy to give. This was donated to us by Again, we'll show some word or phrase, and I'll go over it again at the top of this. Emily's going to cycle through like on the show, what you don't like on the show, lots of recorded live shows, or you can, there's a live feed with our guest, Susan Campbell Cross. And if you have questions for Dr. Granpeesheh, feel free to write those in last Wednesday with her before the end of the year. Okay? So I've caught you up to speed. Without any further ado,
Doreen Granpeesheh is the
Dr. Doreen is an expert in autism. Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
We're going to be talking about anxiety and obsessive-compulsive disorder, which now has a new name, and comorbidities that they have. In other words, similarities that they have or commonalities that they have with autism spectrum disorders. So as I've said before on this show, in May of this year, we had the new diagnostic manual come out, right? DSM-5, Diagnostic and Statistical Manual of Mental Disorders, number 5. And up till May, we had the DSM-4, and the DSM-4 was, very straightforward in terms of how we defined anxiety. So I've kind of put that on the screen first because I want people to be able to see that in DSM-4, what we had was basically, 7 disorders that were listed under the heading of anxiety. There was a chapter called basically anxiety disorders, and they were listed as panic disorder, separation anxiety disorder, specific phobias or fears, social phobia, obsessive compulsive disorder, post-traumatic stress disorder, and generalized anxiety disorder. And that had been that way for many, many years. I mean, I don't even remember the first time I was trained on that, maybe 20 years ago. I don't think there's been a change in the anxiety chapters for a long time. This year now, with the DSM-5, there's been a huge change. So in general, there have been more changes to the DSM-5 than any other DSM, I think. Like this year, they really have changed a lot of things. So what I did was I went through 2 chapters. That's why this presentation is a little bit longer, because we're going to talk about the chapter on anxiety very briefly. And what they've done is they've taken obsessive compulsive disorder, because it is so important and it is becoming so prevalent, that they've given it its own chapter. And it is now called obsessive compulsive and related disorders. So I'm guessing pretty soon we'll be calling it OCRD. And it has its own subtypes and its own features, and so it has been separated. They have now also separated and given its own chapter the post-traumatic stress disorder and similar types of trauma-related disorders. And actually, I don't think I have any slides on this at the end of the talk, but I will briefly mention a couple of disorders that are listed under the PTSD, the trauma-related section, because you'll find them very, very interesting. So right now, what we're going to do is we're just going to briefly look at what is considered anxiety in the DSM-5. And the reason I say briefly is because even after we go through the anxiety chapter, it's repeated multiple times, first in the anxiety chapter and then in the obsessive compulsive and related disorders chapter, that there is a huge overlap or comorbidity between obsessive compulsive behavior and anxiety. So let's repeat that again, because that is the critical aspect of how we are defining and seeing anxiety. I'm going to talk about that a few times. When you obsessive compulsive disorder, essentially, once we get into that, you'll see, but it consists of obsessions or thoughts and compulsions or behaviors that help reduce those obsessions. And the obsessions are usually very, very similar to anxiety. So they're like the same type of stuff that happens when you have anxiety. And that's why it was classified as one of the anxiety disorders. So right now in anxiety disorders, and I'm going to go through these because some of these might sound similar to things that your kids are experiencing. We have separation anxiety disorder. Obviously, a lot of our kids have a hard time with separation from the parent. Selective mutism. Selective mutism is when the child chooses not to speak. It is not the same as autism. I don't want people to go through and think that oh, I wonder if my child is choosing not to speak. With selective mutism, it's usually the child has been speaking for quite a while, and it's environmental. So it's specific to some environments. Like the child will just not say anything at school. And it really has a lot to do with their fear or anxiety of the environment. And then we have specific phobias. Specific phobias are obviously fears of various things. I have had many children who've gone through like different fears, you know, so they'll initially they'll be afraid of, let's say, water, and then they'll be afraid of the dark, and then they'll be afraid of various other things. And specific phobias are really very easy to get through, but they are kind of common in our kids, and you do see some of that. And then you have social anxiety disorder, which is obviously, just by the name, you can tell that this is something that's pretty familiar to our kids. So this is where the child feels very anxious in social settings, doesn't want to approach social situations. And quite honestly, Shannon, this is one where you could say that a lot of people in general have social anxiety disorder, where you don't really want to go to social settings because it makes you very nervous. Now, as I'm saying this, it occurs to me that I should make one thing clear, which is nothing is considered a disorder unless it impacts your daily life in a negative way. I mean, there's a very specific definition of this. And basically, I've used this example in the past where I've said, you know, I could go home and drink a bottle of vodka every night, and as long as I was good to my family and went to work and was a responsible adult, I would not be considered to have alcohol disorder or any kind of alcoholism. So this is very important because some of us have social anxiety. A lot of people have social anxiety, but whether or not it comes to the point where you can call it a disorder has more to do with things like you're so anxious that you will not go out at all, and you begin to sort of stay at home more and avoid a lot of situations of life, and then of course that'll turn into, let's say, agoraphobia, where you're just completely afraid of going out. Or, as you can see from social anxiety disorder, it goes to panic disorders, the next one. And a lot of people will say, I've had a panic attack. And you might have had a panic attack, I don't know, maybe 5 times in your life. But people who have panic disorder very regularly suffer from panic attacks. And it is you actually see physiological changes, heart palpitation, and a lot of symptoms that indicate they're experiencing pretty severe anxiety. And of course, agoraphobia, as I mentioned, is the fear of leaving your home or going out, and that's a very common type of phobia, and it's becoming worse and worse, and it is very much related to anxiety. And then we have generalized anxiety disorder, and generalized anxiety disorder essentially means that there are more than one situation that cause you have a generally high level of anxiety on an ongoing basis. There's a lot of people with generalized anxiety disorder. This one is the hardest to diagnose because it is you kind of come to know the person as that, and you don't identify that they're more anxious in one environment or another because they're just generally always anxious. And what's interesting is the last 4 are a series that are have been added to the majority, a lot of the new chapters in the DSM, and all of it shows how our thinking has changed. So the next one is substance or medication-induced anxiety disorder. And that means that you might be taking medications that are causing you anxiety. And when I start to talk about autism a little bit more, you'll see that that is one of the points that I brought up, is that we don't realize that there are a ton of medications that our kids take that actually can cause anxiety. Not even just medications. If you think about it, our kids sometimes are taking, let's say, vitamin B. Niacin, which is a form of vitamin B, gives you sort of a little rush. That's the vitamin that gives you makes you all tingle.
They call it a flush sometimes.
It's a
in
flush,
your face.
exactly.
Yeah.
And that, for little kids, can provoke anxiety.
Sure.
So there's a lot of medication that can sort of induce the symptoms of anxiety. Then the next one is anxiety disorder due to other medical condition, which is awesome that they have this in here now, because as we go into talking more about autism, I'll mention several different things that actually cause anxiety or other types of problems and disorders. One example being if you don't sleep. Right. If you have a sleep disorder, you are going to be anxious during the day. It's simply that. If you have any kind of, if an adult, for instance, has any kind of other addiction, it's going to result in anxiety. So there's a lot of other medical conditions that will lead to anxiety. And then they have the two last categories, other specified anxiety disorder, in other words, an anxiety reaction to some specific thing, or unspecified anxiety disorder. And those last four have been added to all the new chapters. So when we go into obsessive compulsive behavior or disorder, you'll see the same sort of substance-induced OCD and OCD due to other medical conditions. So it's kind of like it shows the I guess the open-mindedness of the new DSM-5 in terms of everything that we suffer, of course we're whole human beings, is kind of interrelated. One thing causes the other, and so you could have other medical conditions that are causing your problems. These could be causing other issues and so on. So that's just what we're trying to say in the DSM, is that a lot of what goes on is related to each other.
To me, it seems like a very common sense approach to it. I mean,
absolutely.
As parents of kids on the autism spectrum, we know our anxiety level goes up just from our child having a diagnosis. And I think of friends who've been diagnosed with cancer,
right,
and they not only have to deal with the cancer, but they have to deal with all the anxiety that comes with all the things that are going on. It makes sense.
That's exactly right. And if you think about it, that's a great example, because I would say that something like, for instance, other specified anxiety disorder could be something that is induced by having a child who is ill or has a disorder or something like that. Then that would be classified as other specified anxiety disorder, unless it caused you panic attacks, in which case it would be specified as panic disorder, or so on and so forth. So what I'm trying to say is there's a lot of overlap, and one person could go from having, let's say, separation anxiety disorder to agoraphobia or to panic, and so could overlap on more than one of the ones listed here.
Okay.
Now we're going to talk about sort of what do they have in common. What is anxiety all about, really? Anxiety disorders in general are disorders that share excessive fear and anxiety. Okay, so they all have a component of fear and anxiety. Fear is defined as the emotional response to real or perceived imminent threat. Anxiety is the anticipation of future threat. Now, there isn't really much of a difference there. I mean, if you have an emotional response to real threat or imminent threat, it's very close to being fearful of the anticipation of future. Anxiety just kind of lengthens the time frame. In other words, fear is sort of what happens after, just before an event is about to happen, or just before you think an event is about to happen that's scary. Anxiety is worrying about it for a long time.
Makes sense.
It's really that clear. So, and anxiety is usually about real life events. And I'm going to put this in there because you'll see the differentiation a little bit later. So it's important to identify that it doesn't necessarily have to be actual threat that's coming your way, but it is not imagined or fantasy. What anxiety is usually about something that we think is going to happen, and it's possible that it could happen. It's real life. It's not like Martians are going to come and take me. Okay. Although, who knows if that's real? So I'm very open-minded.
Good point.
So, and the most important of all is to say again that there's great overlap between anxiety disorders and this new category or new chapter called obsessive compulsive and related disorders. In fact, there's a 76% comorbidity. That means that 2/3 of people who have anxiety have the other or the other way around. There's a huge comorbidity. So really the only reason that I can imagine that they took OCD out of the anxiety chapters is that it is such an important disorder that it needed to have its own heading and its own chapter, and we will go into that in a minute. Okay. The difference is that obsessive compulsive disorder is usually somewhat irrational. It's somewhat more fantasy type related, or stuff that, you know, most people would say, this isn't real. It can't. So the thing that you're imagining, for instance, being covered with germs, okay, is irrational. You have not been exposed to germs, and you have an irrational belief that you are covered in germs, or you have an irrational belief that some other thing is going to occur, and that's what you're obsessing about. So there's a slight difference there, that anxiety is usually real life situations, and OCD has to do with more things that are a little bit less rational. Although, having said that, I think the next time the DSM comes, they're probably going to remove that distinction, because I can think of a lot of people I know with anxiety where their fear becomes pretty irrational. But I think what they're trying to do is they're trying to make us understand that, you know, and this is how I see it. Like, when you have a very, very high level of anxiety or worry or fear about something, it will ultimately lead to other things. It'll either cause you to do compulsive behaviors, which is OCD, or it'll lead to physiological things like panic attacks, or it'll lead to avoidance completely, which is like agoraphobia, that it perpetuates. That makes sense.
Makes great sense.
And then we'll maybe see if there are any questions we need to answer. We can keep going. So as I said, the new chapter changes now from OCD to OCRD, very likely, because ADD became ADHD, if you remember.
Yes.
Different and persistent thoughts, urges, or feels driven to perform in response to obsession. I left the fire on, the stove on, I'm going to go and check it 100 times. But I love the DSM for this, but when you start looking at the obsessive compulsive, are similar yet different, and how you can try to differentiate, but that there is a huge, huge overlap. And people are beginning to understand that there is a very big component of OCD within autism. It's not listed there, it doesn't say it's there, because the way that the DSM functions, it's sort of like I've said. So if you have pneumonitis, because pneumonia is kind of more overriding than bronchitis, people don't go into do that because it gives OCRD, as well as, let's say, require a lot more work. And so these things are actually important.
Assume and say, well, because restrictive and repetitive...
I mean, it's not that it's false. It is definitely a part of autism. It's one of the symptom criteria that leads to the diagnosis of autism. But just like anything else, you know, it is treatable. Just like anything else. I mean, we look at these disorders like obsessive compulsive, and I'm going to talk about the treatments. Well, clearly with autism it's the same thing. And the way to treat any disorder is to break it up, you know, and look at its individual symptoms and try to deal with the individual symptoms. Now, there are some where we don't know very well how to control them without medication, like, let's say schizophrenia. But nevertheless, schizophrenia, of course, the best treatment is still medication as well as therapy.
Okay.
So, and that's always the case. Pretty much anything I've ever studied, the best treatment is the combination of medication and some sort of treatment, therapeutic treatment. We're going to talk about how to treat some of these, and the medications that help as well.
Would you like to take a break?
I think I'm going to...
Let me
just see. Sure. If there's,
okay.
Let's take
a short break, because I don't want to work you into the ground.
Okay.
This is a lot of information, so we're going to take a short pause, and we'll be back more with Dr. Doreen Granpeesheh. This is the Anxiety Show. Stick with us. Welcome back to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh, and this is the much requested show, the Anxiety Show. We should say it's the first, because we're planning on this taking more than one show, because we want to take our time. This is a very important topic, as you were saying, because it so affects our community.
Right.
And I think primarily we're really interested in knowing about how this affects our kids, but the secondary is that it affects the parents as well.
Oh, absolutely, yes. Our parents have a lot of anxiety generally.
I can speak to that.
Yeah, yeah. No, it's not. It's not hard to develop anxiety symptoms when you have a child you're worrying about all the time.
And knowledge is power, and understanding how these symptoms come about and what to do about them is a powerful, powerful thing. So Dr. Granpeesheh is here today talking about this with us, empowering us. We thank you for that. We went through some of the differences between the DSM-4 and the DSM-5 and how these things are categorized.
Mm-hmm.
So where would you like to pick it up now?
Well, we're going to talk, now we're going to just continue and talk a little bit about the obsessive compulsive and related disorders. And then I will just start going into how they relate to autism as a whole.
Great.
So
we need to tap the screen here.
Oh, okay.
Okay, there we go.
Okay. So the obsessive compulsive and related disorders are listed below, and I highlighted in red the ones that I find to be very commonly seen in ASD. For instance, and we'll go through them, obsessive-compulsive disorder, which I will go further into. Essentially, as I said, obsessive-compulsive disorder is, having obsessive thoughts about something and then doing compulsive behaviors to try to reduce those thoughts. Body dysmorphic disorder is one where you actually have different, you obsess about various aspects of your body. Okay, very simple.
Could result in anorexia, or
it could absolutely result and develop into anorexia or other types of people who, for instance, have a lot of plastic surgery or various other things.
Okay.
Hoarding disorder is where you carry around or you hoard objects. So in other words, I mean, we've all now seen these shows about hoarders and people who will not throw things away and they will keep them. And what the general public doesn't realize is that this is actually a form of anxiety, because it shows that the individual is so afraid that they are trying to sort of, surround themselves with things they own that will help them feel safer. It's always an obsessive thought, a fear related thought, and then a behavior which helps reduce the fear. And in hoarders, it's keeping things around them. Now, I've highlighted that because I know a lot of my children will carry objects, so they will, for instance, you'll see that they'll have a couple of objects that they carry together, and a lot of my kids will have like a little drawer or a little place where they put all their stuff, and they don't let anyone touch it because it's my stuff. And very basic form of this is carrying around your blanket all the time, and it's not really hoarding, but it's the same concept as this object is necessary for me to not feel anxious.
And going back to what you were saying about the panic, all the things under the anxiety, someone might be listening to this and think, okay, well, my garage is a mess. Mm-hmm. But that's different than, it has to get to the place where it's disabling to your life.
It's extremely disabling, yes. It's not really... I mean, we have opinions about who throws enough away or doesn't throw. There are some people who throw everything away, other people who don't throw anything away, but hoarders... Again, it becomes debilitating.
It's another level.
Right, okay. Absolutely.
With all of these things, it has to be at a certain level that it's preventing you from leading the life that you could lead.
Exactly.
In order for it to be classified as a disorder.
That's correct. And then we have trichotillomania, and trichotillomania is pulling out hair. And, I knew someone actually who had trichotillomania, and they were constantly, it was a man, and they were constantly pulling out hair from their beard. And it's an anxiety type of habit, and it's just, you're just pulling out hair. I don't know if you've ever seen that.
Yes, it's a very interesting disorder.
It is. And it's as you notice, the commonality with all of these is, the obsessive or the anxiety feeling and then the repetitive behavior. Remember, that's how we defined it. It's always an anxiety feeling and then the repetitive behavior. So it's kind of interesting. Excoriation disorder is picking skin when you're anxious. And as you know, a lot of our kids do this, so I actually highlighted that as well. And so it's important to note that when you see these things, start thinking about, well, what does it mean if your child is actually from anxiety, for instance, picking skin? Now, this is different from, let's say, a child who might have a injury.
Right.
If you have an injury, it's very common for us to try to pick the skin. That everybody does that. I did that when I burned my hand.
Mm-hmm.
But that's not the same thing. And here we're talking about people that I mean, if you have excoriation disorder, or if you've seen someone with this, you know what I'm talking about, because it gets to be very, very difficult to control.
Yes.
And this is really just because you feel anxious.
Yeah.
Okay. Then we have, of course, a number of medications that can be increasing the anxiety that our kids. Pediatric autoimmune neurological disorder associated with strep, PANDAS. And that is a series of kind of problems and issues and delays that come about if you have had strep infection at some point, and it has led to an autoimmune reaction, which has led to neurological problems.
Okay.
And that is, you know, one of the subsets of autism, and it's easy to diagnose, actually, because well, I mean, first of all, it's surprising. You'd be shocked how many people don't even know if their child had exposure to strep. You don't necessarily have to have seen the symptoms of strep. So a strep titer is done to identify that. But the second thing is that usually with kids who have PANDAS, it was a sudden decline. So it was kind of like the child was progressing, and then at some point there was a sudden drop. And it doesn't have to be the early years. It could be later as well.
Okay.
So that's a little bit different. But, you know, substance and medication-induced stuff is like you're taking, let's say, medication for ADHD, and that will automatically cause some level of anxiety because it's an amphetamine.
Okay.
So, you eat mass quantities of chocolate or red dye, substance-induced.
Okay.
So a lot of the stuff that we eat in our food could be increasing our anxiety levels as well.
Interesting. All right.
Yeah, that's where
Very
the dietary
interesting.
stuff comes in.
Yeah.
Other specified and then unspecified. Now, as I said, that's pretty much in every chapter now. But what I liked about the unspecified obsessive compulsive and related disorders was that they listed a few, and one of them was body-focused repetitive behavior disorder.
Wow.
Body-focused repetitive behavior disorder. So we're talking about...
Here we both automatically start to rock.
Right, so we're talking about certain repetitive behaviors that are just within our body. Now, this is fascinating to me because, and I'm so glad I came into the field of psychology, because I should have been nowhere else. Like, I'm telling you, when I pull up the DSM, you know, and I start making presentations about other stuff, and I am in there for 6 hours. Like, I just don't even want to leave. This is very interesting because I remember I have known people who are not at all on the spectrum of autism, and in fact extremely intelligent people, and not at all in any way hearing impaired or anything else that could lead to this kind of body rocking, but they do, when they're anxious, literally body rock.
Yeah.
So there are people who do literally do that just from anxiety. You know, in our kids, you might see that. You might see a lot of the, and it's funny because with our kids, anxiety and excitement are very difficult to differentiate, obviously. And so when you see our kids very excited, they'll do this as well.
Right.
You know, and if with little children in general, not just kids on the ASD spectrum, but just little kids in general, they'll jump up and down if they're excited as well as if they're anxious, like when you're fearful and so on. So the commonalities between the obsessive compulsive disorders are that here's some different aspects of them. So there's the commonality, as I said, there's some obsession and then there's a compulsion. So these are the different types. A cleaning OCD, which means there's contamination obsession and then cleaning compulsion. A symmetry type of OCD. So that means there's an obsession about things not being in perfect order, symmetry. And then there's a repeating or ordering compulsion. And that's the one that you see the most in ASD, where I think we even had some questions on this, where you see a child will put things in a particular order, lining up objects, their toys and so on, or items, and getting very, very upset if you change the order of the objects or if you destroy the line. So this is actually a very common thing, and it's not just in putting things, not just in tangible order, but it can be stuff like there's no symmetry because you're taking me to school from a whole different direction that we usually go. There's no order. Doesn't make sense because we've never done this before. So change.
And inflexibility.
Inflexibility. That's exactly the word. It has to be this way. It's the things have to follow a particular sequence, and if they don't, it's the end of the world.
We actually have a question having to do with this. Do we want to wait for that towards the end?
Sure, we can throw it in right here.
Hi, Shannon and Dr. Doreen. Thank you so much for discussing a very important topic. My daughter is 8 and was diagnosed with autism when she was 3. She likes to keep things in their places, like toys and bags. She also likes to close open doors and zip up bags. She gets upset if we change the places of the toys or backpacks and insists on putting them back. If the bathroom door was open, she runs to close it and gets frustrated and bites her hands if we try to block her. What is the best way to manage these behaviors? And we appreciate Dr. Doreen's feedback in advance.
So we're going to talk a little bit about how to treat these behaviors later, probably more next week, so please stay tuned with us, because if I jump into that, I'm going to kind of go heavily into the...
Absolutely.
But the thing is that, I want people to think about it this way. Like, if someone is blind, okay, if someone does not have the ability to see, they will, how do they manage in their home? They place things in a particular place, and they don't want things moved. And the reason for that is so that they know where things are, right? Because they can't see them, so they know where things are, so they can depend on things being where they left them, and that's how they function in the world.
Right.
Okay.
It's a great coping mechanism.
It's the only way that they can cope. Exactly. So now think about it from an autistic person's perspective. Things are placed in a particular way because they receive. Now it's more irrational, obviously, because you can see as well to some extent, and who knows how well our kids actually have visual skills, but some of our kids. But it gives you a sense of control. Having things in a certain order removes completely the surprise element. There is no surprise involved. So with your child here, there's no surprise, and she wants, and everything that this parent listed has gone to an irrational level or to an excessive level. But if you reduce it, then you can see how it developed. It's like, okay, so what were they? She places things in an order, I think.
She likes to keep things in their places, like toys and bags.
Right.
She also likes
so that she knows where they are.
Right. She likes to close open doors.
Right, because that gives her a sense of safety. Now, keep in mind, we're always talking about behaviors that reduce fear, reduce anxiety.
And zip up bags.
Yeah, so that they remain orderly or clean or whatever.
She gets upset if we change the places of the toys or backpacks and insists on putting them back.
And then she gets all worked up and bites her hand and so on. And as I've said multiple times, biting and those types of behaviors is simply communication. She's trying to say, don't do this. It upsets me when you change the order of things. And I don't want anything changed because this is the only way I feel safe in the world. Very simple. So you understand the cause, you understand what's making her feel that way, but you don't want to really reward the fact that she's biting her hand every time. So that still means you behaviorally intervene, and you don't necessarily stop doing what you're doing every time she bites her hand, because then you would be rewarding the hand biting. But it's always important to understand the reason. Remember, we talk about the function, and one of the things I we're writing a book right now, and I kind of want to be brave and write a new thing about how we talk about the function of things being, the function of behaviors are always like to avoid something or to gain access to something, and one of those key things in my mind is to avoid or reduce anxiety.
Absolutely.
A lot of what we do in our world is just to avoid anxiety. A lot of what we do, honestly. If you think about it, something as simple as alcohol. Drinking alcohol has to do just simply with reduction of anxiety. That's all it is. What do they say? It reduces inhibitions, which means it reduces fear. So, and because I'm one of those people that believes life is about fear, like overcoming your fears, that's why we do all the different things we do. Now, with this child, it would be important to the reason it's important to know why the behaviors are occurring due to anxiety is because then you can help the child overcome the anxiety. And that's where you focus your attention, is doing things that will help the child overcome the anxiety. And there are many things you can do, medications being one, and we'll go into some other cognitive behavioral treatments as well.
Okay.
So now with the OCRDs, the other two, forbidden or taboo thoughts and harming self or obsession about harming others, is stuff that we don't very commonly see in our kids. So I'm just going to try to skip over those and keep going. Okay.
Okay. Do you want to take a break?
No,
Okay.
I'm going to keep going because we don't have very much time left.
That's
and then
true.
Next week we'll go heavily into the relationships. Let's just see where we are now.
Okay.
So one of the really important things, I know a lot of people will ask this question, is that, when you look at first-degree relatives of an individual who has obsessive-compulsive behavior or disorder, so that means, first-degree relatives, so child-parent type relationship, is the rate of obsessive-compulsive related disorders is double in first-degree relatives. So in other words, if you have obsessive-compulsive related disorders and I don't, okay, that's the normal relationship, but your child might have twice as much the likelihood of having obsessive-compulsive related disorders. Now here's the second point, which is more important. If you had obsessive-compulsive disorder as a child, then the likelihood that your children will have it is 10 times as much.
Wow.
Yeah. So that I found to be very interesting because, it is something to think about.
It absolutely is something to think about.
And and we don't know right now, we call it, it's under the heading of genetic components, but you don't really know if that's true because I was thinking about this, and if you, as a child, have obsessive-compulsive disorder yourself, the question really is if you've gained control over that as you become an adult, because if you haven't, then it's possible that you would, your anxiety would then kind of affect your child's or your family members. So that's another, it's sort of a behavioral or environmental component of it as well.
I absolutely, I've shared before on the show that I have some of these things that we're talking about.
Yes.
I certainly have battled anxiety and OCD, and like a lot of moms on the who have children on the autism spectrum, I fully go, yep, I have some of these things. And it wasn't until my son had autism that it got to a rate where I needed to seek out help. I didn't seek out help until I saw my son starting to engage in some of the behaviors that I did. And that was when I got my wake-up call and I said, okay, this is not okay.
Yep.
I have to get help for this because otherwise I will have changed the way he looks at the world. And I just refused to do that. It was hard, but I got help.
Yeah, that's exactly right. It's so sad when you see, I go back and I think of some of my patients and also some people that I've known, patients outside of ASD, and it is really, really sad. I mean, it's pretty debilitating. I remember, first of all, I remember someone I knew who had their OCD had become extremely severe, and it had turned into agoraphobia. They would not leave the house, and when you went to visit, she had gloves on, plastic gloves on, and a sort of a cleaning spray and thing, and that's how she lived from the minute she woke up. And it was extremely sad, not just to see what she was going through, but how it was affecting her. I think her daughter was maybe 14 or so at the time, and it was really causing, like, even to a level of psychosis for her daughter, because her daughter was having, like, must have probably been through many years of this. And you know, it causes an ongoing fear because you never really know when the person is going to react to you and blame you. I mean, I knew someone else who actually used to get very angry if someone had hair, you know, a strand of hair that would come off because it would freak them out that it's going to fall on the floor or something.
Yeah.
OCD can be pretty severe.
Yeah.
And then I remember a mom I had who wouldn't even come to our clinic many years ago because she felt that the world was too toxic, and so we couldn't actually help to see her child because she wouldn't leave the house with her child. She wouldn't allow the child to go to school. Because not because she was worried about the child, she was worried about the child bringing germs home to her.
Right.
I mean, it was can be very devastating.
Yeah. I mean, I stopped driving. I was 40 whatever years old, and I stopped driving and pretty much had said that I was never going to drive again.
That's amazing.
And I was somebody who had always been a road warrior. I'm a road warrior again. I commute a great distance to come here every morning, but I had stopped driving for over a year. And so when we came to clinics, my husband had to be present. I mean, usually that was the case anyway, but he absolutely had to be because otherwise we couldn't drive here.
That's amazing.
So, you know, I relate less and less to the point where, you know, I pretty much, I want to go home. I don't feel right. I don't feel good. I want to go home. I want to go home. And here my child had picked that up. So
that's right.
you know,
right.
but
I want to skip to another, if I can find those slides, treat things and to help your child that way, right? It helps us coping, okay? But when it becomes excessive, many years ago, there's a curve that occurs. People who only want to have a slight amount of the ability that I want to look at, but I want to, this is really important, like we are, I asked, well, what would you say you feel to our kids when we come back next week? So many of our kids don't sleep, and we just, how we can possibly be treating our kids with anxiety. So always remember, so it's kind of like you jump from one thought to the other, which actually affects this slide as well. And how do we deal with anxiety? Ways to help our children deal with anxiety and talk to my friends or gain a behavior that comes out of reduction of fear. That's when people pray most, right?
absolutely.
I take medications to help me. I exercise. That would be a very adaptive, healthy way to deal with it. I breathe, I meditate, I do yoga. So this is one of the areas that I'll talk about next week, what we can teach our kids. I practice positive self-talk. I try to change my beliefs. That's what I think more than anything else ABA helps our kids to accomplish, is that they actually start to learn that their thoughts are not rational. I try to change my beliefs. I avoid what's making me anxious. That can lead to complete avoidance, which is not good. I take drugs, alcohol, or I try to change what's causing me anxiety. So these are, you know, and whenever you see the word change in behavioral terminology, that means shaping. So next week, what we're going to be talking about is behavior change and how do we make that change occur. What I'll do next week is I'll go more into sort of what happens in autism that leads to anxiety, and then we'll talk a lot about treatment.
Potty training is different for every child. A child could come in with absolutely, no over there, and as long as that's not a medical issue, then we can certainly approach it behaviorally and give them the tools they need to be successful, just like any other skill that we would teach.
Well, we think he's learning to pee on the potty. No big successes yet, and lots of accidents. Here is the laundry from today.
For some of our kids takes, just a couple days, and then for other kids it can take months and months and months, and then when you're looking at complete independence, it can take years.
Hey, you have to go pee-pee?
There's a lot of different ways to tell if a child is ready. We look for a couple different things. Probably the most important is parents saying, I need this to happen, I'm ready. Second is, a child showing interest in the bathroom, and some of it is simply age. It's time to go ahead and work on this.
What are you doing? Pooping. You're pooping?
You first start with teaching the child what they need to do on the toilet. The basic thing we want is for them to drink as much liquid as possible. It's inevitable that if you drink a bunch of liquid, you're gonna pee.
Help! No, I can't help you pee. Help. I can hold your hand, but I can't help you pee.
Ultimately, what we want is that, the child, as soon as they're put on the toilet, they urinate. So that's step one. Step two is usually working through the amount of time that they're off of the toilet and making sure that they're not having accidents during the time that they're off. So this is kind of the bladder control stage of things.
So the purpose of the potty log is just to see how long it takes them as soon as they sit on the potty for them to actually urinate, and the amount of time that he's able to hold his urine. And with the log, we're able to visually see how long it takes them each time and if they have accidents or not. He's on a half-hour potty schedule, so if he doesn't go when we take him, then we have to take him in 10 more minutes. So every 10-minute intervals until he does go, and then we reset the clock, and it's 30 minutes again.
Okay, buddy. Okay, last chance to go pee-pees. Do we reset it for 10?
Oh, what does that mean? What does that mean, Jack? It's potty time. We can come play after. Hurry.
What we hope happens in this time is that the kids will learn how to initiate going to the bathroom on their own. This is oftentimes the hardest part of potty training, is because they get so used to somebody telling them when they need to go that they're not really recognizing the signs just in their own body of when they need to go.
Uh-oh, he wet himself.
Uh-oh. Big wet?
Was it a lot? We can reset to half an hour now.
The biggest thing for parents is not to give up. The other big tip, and I think pitfall that a lot of parents fall into, is putting their children back into pull-ups or diapers, especially if they're starting to have accidents. And this is probably the worst thing that you can do. They need to recognize that feeling of fullness in their bladder and take themselves to the bathroom, or tell an adult that they need to go to the bathroom.
What do you have to do? You have to put your pee-pee in the potty. Okay, give it a shot. See if you can put it in there. There you go. You're doing it. Yay, Jack.
Big prayer for your pee-pee. Big
Yay!
pee-pee.
Woo! Yay! Good job.
What a big boy!
High five! High five! High five! High five! High five! High five!
Welcome to Let's Talk Autism with Shannon and Nancy, and I hope you enjoyed both Dr. Doreen Granpeesheh doing the first half of the anxiety show and watching that most recent, a recent episode of the A Word. So thrilled to be here with you for Let's Talk Autism with Shannon and Nancy. Unfortunately, Nancy Alsbaugh-Jackson has been called away for a family emergency. We're wishing her well, and the show continues on, right? And in just a few minutes, we're going to be joined by Susan Campbell Cross, and she's got some amazing tips for us on how to get through this winter break in a really productive way. I read through these tips, and let me just tell you, I'm so excited for what she's going to share with us. But starting here at the top of the show, I want to remind you that we are still participating in the holiday giveaway extravaganza. I have here this lovely Lego bucket. You can see all the pieces that it comes with here. You can build so many things with this. This is the toy for this hour. At some point during the hour, Emily will flash onto the screen a word or a phrase. You'll want to write that word or phrase down. That's the mystery phrase, right? And you want to email us before 7 o'clock tomorrow morning Pacific time. Emily will put the email address up on the screen for you. And And in the subject line, you want to put the Lego bucket. And in the body of the email, you will want to put the word or the phrase that she shows at some point during the next hour. And you can win this amazing toy. Of the correct responses, we will choose one winner, and they will receive this fabulous Lego bucket of wonderfulness that was donated to us by Toys R Us. So we want to say thank you to Toys R Us and encourage you to participate. All right, so that's what's happening this hour. And remember that every hour between now and next Friday, December 20th, that we are live, we will be giving something away. So stay tuned for that and make sure you tell other people about it. It's good karma when you tell other people about it. Now, we always like to start Let's Talk Autism with Shannon and Nancy by going over some of the stories in the news. And I'm loving some of the stories that we've got today. The first one I want to talk about, because we've talked a lot on the show about gut issues, and that the growing thought is that gut issues has a lot to do with how we behave. To me, this is a duh, that of course, if your stomach isn't working well, you're not going to be happy. As Matt Asner said with us last week, if your colon is not happy, you don't have a happy life. I think there's like some phrase in another language that it translates a little bit more beautifully, but happy colon, happy life, right? So there's a study, and our title here is Probiotic Therapy Alleviates Autism-like Behaviors in Mice. That researchers are investigating a potentially transformative new therapy for autism and other neurodevelopmental disorders by using co-occurrence of brain and gut problems in autism spectrum disorder as their guide. The study, which is being done by scientists at the California Institute of Technology, is the first to demonstrate that changes in the gut bacteria, the community of bacteria that populate the human GI tract, can influence autism-like behaviors in a mouse model. To study this gut microbiota brain interaction, the researchers used a mouse model of autism previously developed at Caltech in the library of Paul H. Patterson and Ann P. and Benjamin F. Biagini, professors of biological sciences. In the new cell study, the colleagues found that autistic offspring of immune-activated pregnant mice also exhibited GI abnormalities. In particular, the GI tracts of autistic-like mice were leaky, which means that they allow material to pass through the intestinal wall and into the bloodstream. To see whether these GI symptoms actually influence the autism-like behaviors, the researchers treated the mice with I'm not going to be able to say it, Bacteroides fragilis, a bacterium that has been used as an experimental probiotic therapy in animal models of GI disorders. In addition, observations of the treated mice showed that their behavior had changed. In particular, they were more likely to communicate with other mice, had reduced anxiety, and were less likely to engage in a repetitive digging behavior. The B. fragilis treatment alleviates GI problems in the mouse model and also improves some of the main behavioral symptoms, scientist Hiyoshio said. This suggests that GI problems could contribute to particular symptoms in neurodevelopmental disorders. We've talked before on the show about probiotics and the role that they play in autism, and when somebody isn't on the autism spectrum. I've been talking about probiotics a lot. Having the right probiotic and having the right amount of probiotic, and by the way, you get these without a prescription, so anybody can go to a store and purchase probiotics. You want to do the right amount, and the right probiotic can have a life-changing effect on how your colon feels, and it also helps to reduce anxiety. I can attest to this personally. So love that more and more people are talking about that brain-gut connection, and that there is a behavior component that goes along with it. Very exciting. We're looking for more research on that. Interestingly enough, in a side note, Katie Couric has recently been talking about the HPV vaccine for girls and her concerns about it. And it seems that a campaign has been mounted to tar her with this in the same way that we have seen other people be tarred. A show entitled The Big Conversation went live on December 5th, where Ms. Couric aired concerns that vaccines given to women could be a leading cause of cervical cancer. Again, she was talking about the HPV vaccine. An article written by Paul Mountjoy, a retired psychotherapist and a writer, then turns to Jenny McCarthy in her crusade to ban vaccinations for children, as she believes, as they believe she was quoted in the 1980s. She didn't say she was anti-vaccine. I've seen so many clips of Jenny McCarthy. She never said she was anti-vaccine. But Mr. Mountjoy wrote this about both Jenny McCarthy and Katie Couric. Jenny McCarthy has long been soapbox style promoting her opinion that vaccines contribute to the rise in autism, despite the fact that the CDC, the Institute of Medicine, and many other well-respected medical reporting agencies have debunked such fears and cannot find a relationship between vaccine and autism. Perhaps taking advice from celebrities who search for controversy-stirring angles may be detrimental to one's health. Getting the facts from qualified medical experts is the best approach for making health-related decisions. We want to thank Mr. Mountjoy for his opinions and point out that people are allowed to talk about what their concerns are, even when it involves vaccines, whether that be Jenny McCarthy or Katie Couric. And I want to point out that I don't think anyone has ever made a decision, anyone that I know, and certainly myself, a decision about what to do medically based on what a celebrity says. Although we appreciate knowing sometimes we appreciate knowing people's opinions and their concerns. Thank you, Mr. Mountjoy. And I applaud Katie Couric as a journalist for talking about what she has concerns. The woman has faced a lot of things having to do with cancer in her life, and she's entitled to have her opinions. I think you'll all agree with me there. Another study that this is one of those does that's heard around the world. Autism parents face prolonged risk of divorce. A new study finds that that even after, typically if couples can survive the early child rearing years, parenting demands decrease, and there is often less strain on a marriage. That's for typical concerns, says Sigan Hartley, an assistant professor of human development and family studies at the University of Wisconsin, and the lead author of this new study. However, parents of children with autism often continue to live with and experience high parenting demands into their child's adulthood, and thus marital strain may remain high in these later years. Hartley and her colleagues followed families with children ages 14 to 57 starting in 1998, continuing until 2004. Ultimately, they found that parents of children with autism were more likely to divorce over time, with 23% of couples parting ways versus 14% of couples whose children did not have autism. We continue to get a wide range of statistics on what the divorce rate is for autism, but another study showing that it is higher because the stress level is higher. I think we can all say, duh, about that. But we do the best we can, right, in all cases. In the last study that I want to talk about today is not so much a study, an article. I want to encourage you to check out the Huffington Post, that our dear friend Shelley Hendricks has written a post called Getting Job Ready with Autism, and how she has been able to do this with her son, that her son has been working a job for the last 2 years, and what she feels are the important steps. And I don't want to take the time to go through the article, but I want to encourage all of you to check it out. It's on the Huffington Post this week. Again, it's called Getting Job Ready with Autism by Shelley Hendricks Reynolds. She is an activist and somebody very involved in autism votes. And check it out. I think you'll really like it. Very well written. And then we also want to do a shout out to Michelle Wissell from the Las Vegas Guardian Express, who posted an article this week talking about some different things you can do to help yourself during the holidays. In particular, having sensitive Santas. This article really touched my heart. She gives some very down-to-earth suggestions about how to prepare for the holidays, how to use social stories to talk your child through the kinds of things that are going to happen, whether it's to sit on Santa's lap or to be at a holiday dinner, how to get the rest of the family involved. Some really good suggestions, including earplugs when you're going to a big event. But I love this idea of, a lot of times you'll go to a place and want to put a child, whether they're on the spectrum or not, on Santa's lap, and it's a big costume. And it's got a lot going on, and there's lights on, and there's going to be cameras taking pictures, and kids of all ages freak out. I happen to know my husband is somebody who regularly has, he participates in this, is a Santa helper, let's say that, depending on who's watching. He is a Santa helper during the holidays, and frequently even has a gig this weekend where he will be a Santa helper. And he is a particularly good one because he has been trained in being a sensitive Santa. So especially with the smaller kids, he lets every child approach him and he waits to see what their deal is. And he makes smaller motions that those Santas who stand up and go, ho, 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 and do these big motions can scare children of all ages and of all abilities. So, it is possible to go, if you're going to the mall and you're going to have your child sit on the Santa lap and you're looking at the Santa and it's somebody who's making big motions, talk to one of the elves. Take an elf aside and say, I'm going to be back at 5 o'clock with my child on the autism spectrum, and he's going to be wearing such and such, and I need your Santa to pretty much pretend he's a statue, and talk very low and not make any sudden movements, right? It's a big red costume with a lot of white curly stuff shooting out of it. So we can ask for those things and get those things, and a lot of Santas are already trained in that. But you can do the recon first if you want to get that good picture. I encourage you to do that. But you can also check out Michelle Wassell's article on the Las Vegas Guardian Express. You can go to guardianlv.com to see that. Autism Made Easier at Christmas with the help of sensitive Santas. All right, we are going to take a short break. We're going to come back with Susan Campbell Cross. She's a lifestyle expert. She is the author of FabYOUlist, the List It, Live It, Love Your Life. I can't wait to talk to her about that. And she is a lifestyle editor for Shape, OK, and Star magazines. She's been with us before. You're going to want to check out her book on Amazon.com, but she has got some amazing tips for us on how to have happy, greatly stress-reduced holiday and winter breaks. So stick with us. You're going to want to see this. Susan Campbell Cross when we come back.
Hi, we're at the Toys R Us in Porter Ranch, California. And Emily and I are going to take a little tour around the store and find some great toys for some great kids.
All right, let's go.
Come with us.
Yes.
Okay, bring your dinosaur and come on. Let's go look at things in the game aisle. I know you love games.
I do love games.
All right. So here we are in the game aisle, Emily, and I want to show you that there's all these games that you can get for kids of all ages. They're interactive and really remarkable. One of the hot toys this year and many other years is the Bop It toy.
Okay, so what about the Bop It is so reinforcing?
Well, you know what? It can be interactive. It can be a social game. It makes lots of noises. Sometimes they light up depending on the version. It helps to work on fine motor skills, and it helps to work on fluency. This toy will grow with the child, and in fact, you can get it in different versions. This is a little bit more complex version, and up top here we have one that's especially for older kids. It's called the Smash the Light. I would wait until a child is older to play with this one. So should we check out the Lego aisle?
Yes.
Okay, let's do it.
Go. So how can we use Legos to help our kids?
Well, they're really spectacular toys for our kids because they work on executive functions and planning. They're really colorful. You can work on colors and grouping and matching, counting, because they have the little dots on the top. And if you have a younger child, you can start with the Duplo toys that are compatible with Lego and don't have the choking hazard.
So then as the kids get older, what's great about Legos, it looks like, is that there's all sorts of themes. We've got movies here and video games, so the kids can really connect with what's personal to them. So Legos are amazing, but what else do we have to see?
Let's look at some educational toys in the leapfrog aisle, shall we? Okay.
Okay, so what do you have here?
Well, we're in the leapfrog aisle. This particular toy, very popular this year, is a leap reader. It comes with a little pen, and it tells us that we're going to read, write, and listen, all skills that we want to work on with a child. This pen that's in this box, you can put it over different pages in the book. It will read aloud to the child. They can trace their letters. It reinforces them for doing a great job. It's a really spectacular toy for our younger kids that are working on reading, writing, and listening.
This looks like a lot of fun and a really great way to help our kids learn to read and write.
Absolutely.
What else are we going to play with today?
I think we should take a trip down the functional pretend play aisle. This is where you're going to find all the things that are like real, but the toy version. So I've got this lovely set here that's all fresh vegetables, so I'm teaching nutrition at the same time. They're all appropriately colored, but I've got a knife so I can be cutting them too. This is really great play for a young child.
Shannon, I heard you got some toys that I get to play with now.
Yes, I'm going to take you to the demo table. We're going to let Emily play with some toys, and we're going to be giving some of these toys away on the show. But they're not just any toys. These are toys that are featured in this year's Toys R Us toy guide for differently abled children. And this is put together with the help of our friends at Lecotech.
So what do all these different icons mean?
These are different icons that tell us what skill this toy might help to develop in our children.
So can I play with the toys now?
Yes, it's time to play with the toys, Emily.
So I think I recognize this guy.
Yes, this is the ever popular and very sweet Elmo. But this is a very specific Elmo that teaches adaptive skills like zippering.
Almost yellow triangle zipper.
And so we get the reinforcement of Elmo talking to us when we do these things. Let's keep playing. So it encourages the child to continue to interact. And he's very reinforcing. When he giggles, I just want to hug him and play with him some more. Okay, so moving on, let's look at some Melissa and Doug toys. These are incredible toys. They'll last several different generations because they're made out of good quality wood.
Awesome.
And let's start with a lace and trace toy. Now, I happen to know that you love turtles,
Emily. I do love turtles.
And this is a set of farm animals lace and trace. And the child can pick out a color that they like for a lace.
All right.
And there are lots of different things that they can do with this. And I know it might seem like this is an old-fashioned toy, but you know, sometimes the old-fashioned toys are the best toys. Because what you're doing right now, Emily, is that you're using a lot of hand-eye coordination and you're using the pincer grasp. This is a precursor to writing right here. If you've got a child who's having difficulty holding a pencil, this is a really reinforcing way to work on this. And it comes in lots of different things. And then also for Melissa and Doug, we have this amazing switch and spin. Love this so much. This is a great cause and effect toy. As we start to put the gears together, we notice that when you turn one, another one can turn. You can rearrange this and do it in lots of different ways. There are 10 design boards, so you don't have to just do fish. There are other things that you can put there instead.
That's awesome.
Kids love this toy, and it's another Melissa and Doug toy.
Cool.
All right, let's take a look at some fun games.
So I found this game, and it's called Fibber. So Shannon, I'm going to need you to put on your fibbing glasses.
I want a fib.
All right. So this game is totally reinforcing, and it helps our kids to work on lying.
Yes, and that's something we really, I know it sounds strange, but we want to work on that because being able to tell a lie is something that helps with safety issues. And also being able to tell if somebody else is lying is a really useful life skill.
What you need to do is get rid of your cards without trying to grow your nose, kind of like Pinocchio.
Okay.
But if you get caught...
And so eventually you can have a whole string of noses attached to the end of your nose. Very colorful. Again, we can be working on the colors. Kind of hilarious. A kid's going to want to play this with mom or dad and see that mom is Pinocchio telling lots of lies. I like this game a lot.
This is a great game.
We've had a really great time at Toys R Us, and all of the toys that you see here on the table we're going to be giving away on the show. So stay tuned to find out how you can win one of these great toys.
Welcome back to Let's Talk Autism with Shannon and Nancy. So thrilled that this morning we have back with us Susan Campbell-Cross. So happy to have you here.
Thank you so much for having me back.
We're
I love
so
coming
excited
to visit you here.
And we have to talk a little bit about what you've been up to because you are an amazing person who is very busy and very mindful, and you do amazing things. Already in the studio this morning you've done amazing things. But you're a lifestyle expert. You have a new book out.
I do.
That's called the FabYOUlist. with you all in caps. So it's FabYOUlist, and the subtitle is List It, Live It, Love Your Life. You have to tell us what that's about.
Well, it's about reinvention at midlife. It's a funny self-help memoir. It follows me along as I take on the challenge of accomplishing 40 life goals before my 40th birthday.
Amazing. No one would believe that you are even close to a 40th birthday, but look at the cover of that book. How fabulous is this?
Oh, thank you.
And you did some amazing things on your list of things to do, and it's an inspiration to all of us.
Thank you.
To get up off of our couches and do the things that we want to do and live the life that we want to live.
Well, number 40 on my list was write a book, and the book is how I crossed off numbers 1 through 39, and I'm so excited that it has inspired people to light that fire under their butt and get out there and accomplish the things that they've always wanted for their lives.
Amazing.
Thank
and so
you.
people can get that on Amazon.
Yes.
They can check that out on Amazon. But you are also a lifestyle editor for Shape Magazine, OK, and for Star magazines.
Yes. Yeah, that all came about because of living my list. A lot of the things that I had down there on my list stayed a part of my life, and one thing kind of leads into the next. Once you start getting out of your way, amazing opportunities just rise up to greet you in life. And I had on there get an article published, and I had on there be Googleable, which led me to start a blog. And so I started getting back in the habit. I had been a writing major in college, but it got me back into the habit of writing every day and putting my writing out there for the world to see, which was a huge step for me because I was really always a little worried about what other people might think.
Really?
I got over that.
Because you're amazing.
Oh, thank you.
You're absolutely amazing. Even we're going to talk in a second about some tips that you have us for the winter break. But I since the last time you were here, I've been in your house, and people should just come and see your refrigerators, because if you want to see how to live, you need to come and see her refrigerators.
Well, I've got 3 teenagers, so I kind of needed the refrigerator space. I love to cook. I do. I love to cook. And, you know, with a family of 5, you kind of need to have the space to store all of that good food. And I love fresh vegetables, anything, you know, I don't want a bunch of canned stuff. So I like to have the storage space in the refrigerators.
Well, I want to be you when I grow up. I'm just saying that.
That is a huge compliment, because I want to be you when I grow up.
Well, I don't know why, because it's better to be you, trust me.
I don't know about that.
But in any case, you've got some tips for us, for some great winter break tips, because everything's going to change a little bit over this winter break, and especially as you've said before, for families that have a child on the autism spectrum, it can be extra stressful, and we lose some services. So I looked through these tips, and I just thought they were amazing.
Oh, I'm glad. I hope that they're useful. I really do.
I guarantee that they will be. So let's start out with what the idea behind this is, because you've got a way for us to remember this that I like.
I like to refer to this as the KISS method. Keep it simple, sweetheart. Some people say keep it simple, stupid.
I like the sweetheart better.
I like the sweetheart better too. And basically that just means don't complicate things. You really don't need to complicate things. The more simple, the better. Especially, I think, with for parents who have kids with special needs on the autism spectrum.
Yes.
You know, the more simple you can keep it, the easier it's going to be to do your follow through and, you know, make sure that you're creating an environment that everybody can have success in.
Absolutely. And so what's the first thing on our list of tips?
Well, the first thing has to do with consistency. Try to keep as many things the same as you can. I know that school won't be in session, and like you said, a lot of the services are suspended during holiday breaks, and that can be really challenging for both you as a parent and your child. So, you know what? Keep as much of a routine as you can. You know, maybe there's no school, but you can still wake up at the same time. You can still have breakfast roughly at the same time, lunch at the same time, same for dinner. You know, bedtime rituals can stay the same. Try not to let your kids stay up later and later. I ran into that problem myself with my kids. Bedtime seems to creep later and later when you're on a holiday break, and boy, can it make it difficult when it's time to go back to school, because they're all off schedule. So the more you keep the same, the easier the transition's going to be back into school when it starts up again too.
I love this tip, because I think we all get in that mindset of if things can't be the same, then let's throw out the rule book.
Exactly.
But it creates problems, and we can look at this in this way and remind ourselves ourselves, thanks to this tip, that there are a whole lot of things that are within our control.
Right.
That we can, how much can we keep the same, because we will benefit from that.
Yes.
We're going to take a short break here, and then we're going to come back and go through some more tips that it's going to make the light bulb go off in your head. You're going to love what Susan has to share with us. So stick with us. We'll be right back after this short message.
Hello, fellow activists. Last segment, we talked about step 3, get support. Step number 4 is don't compare, run your own race. Now, it's one thing to aspire to be like someone that's really helped their child. We all want to do that. That's really different than keeping up with the Joneses. That only serves to make you envious and full of regret. There will always be someone who has a child with autism who is doing better than yours, and there will always be someone who has a child with autism who's doing worse than yours. One morning I was talking to the mom of a recovered child who told me he had been moved into the gifted class. Well, I had heard that week that my own son, who was in 5th grade, was reading at 1st grade level. Now, I have to admit, I was kind of proud of him until that phone call, which put me over the edge. The green-eyed monster of jealousy. Well, later that same day, I got into the elevator as I was taking my son to clinic. There was a father with his 2 sons, one typical and one with severe autism. He was pretty much nonverbal, but he did make some very strange sounds over and over again. He had bite marks, scratches all over his arms. He wore mittens to protect him from himself. The father, however, had a big smile on his face. Needless to say, the universe was sending me a message that day. Don't compare. Be grateful for the progress your child has made and will continue to make. So until next time, keep running your own race at your own pace. Don't forget to stop for water and keep the faith.
Welcome back to Let's Talk Autism with Shannon and Nancy. Our special guest here in the studio with us today is Susan Campbell-Cross. She is a lifestyle expert, and I can attest to this. I've been to her house. Everybody wants to live her life. You're so organized.
Well, don't
it's
open all the drawers. Some of the drawers aren't so much.
You know what? But you are, and just the way you came in this morning, you are an expert of making it work, which is what we all want to do. Always. So I just think it's amazing, and I love the fact that you're here to help us, because autism parents need just as much, if not more, help in making it work. And by the way, you can get Susan's new book, FabYOUlist, List It, Live It, Love Your Life. You can get that on Amazon.com. Life-changing book, because you transformed your life by making this list.
I became much more me, and my life completely changed. I'm really confident that I am living the life I was meant to live. I really know that now, and I feel like my purpose is helping other people discover theirs, and I just feel really good about the work I'm doing now.
I love that. And it should be no different for those of us who are, whether you're on the spectrum or you have kids on the spectrum, we can do that as well. And Susan can help us to do that. And you are also a lifestyle editor for Shape Magazine, for OK, and for Star Magazine. So the list goes on of your accomplishments. It's absolutely incredible. And Susan is helping us today with 5 simple tips to get through the winter break. We started with this concept of keep it simple, sweetheart.
Yes.
The KISS, as you say.
Absolutely, and trying to stick to your routine as much as possible.
Yes, that was tip number 1, keep the routine. So I love tip number 2. Tell us about this.
Well, tip number 2 is one and done. You don't need to fill up every hour of the day with umpteen different outings and activities. I think it's best to really try to focus in on one great quality activity per day. Doesn't even have to be outside the house. You can have a baking day, storytelling day, videos, let's make popcorn day. And I think it's really nice too when you can include your children by planning it ahead of time and giving them the heads up as to what you're going to be doing. You can even post a fun calendar with pictures so that they know what's expected and what's coming up for them. And you know, just in case though, I always say it's good to have a plan B, because you never know if it's going to rain or if, whoops, I'm out of sugar after all. But if you have a backup plan, you're going to always find that you'll have something fun to do every day of break.
I love this tip, and can I tell you, when I read it, I took a deep breath, because my husband has said this to me many times, that I try to cram too many things, shoehorn things into a day. That, well, we have to get to this event from 2 to 4, and there's an event that starts at 4:30, so we're going to do that, and then we have to be someplace at 6 o'clock. And by the 4:30 thing, we're already an hour behind, and I'm in
It's
tears,
stressful.
and my child is saying, "Can't we go home?" And my husband is going, right? You know, so I love this for my family, this idea of one and done.
It helps you avoid the dreaded overactivity-itis. I like to call it overactivity-itis, where we're going from thing to thing to thing to thing without taking time to really enjoy what we're doing, and it just causes so much stress.
Yes.
So this really should help with that.
Yes, I remember one holiday where we went to a Christmas party. We were there for a half an hour. We had to leave to go to another Christmas party. We said we'd come back to the first Christmas. We spent the whole night in the car.
Not fun.
We never got to talk to anybody.
Right.
It was miserable. So one and done, love it. Okay, speaking of parties, we've got tip number 3.
I think a lot of people who have many kids or really small kids or special needs kids feel like it's really hard for them to entertain themselves, to invite people to come into their home, because there's this expectation that it's going to be this great big spread, you know, hours and hours of cooking, and everything has to be homemade and just so, and Martha Stewart approved.
Yes.
I love Martha Stewart, but I do not aspire to be Martha Stewart anymore. I think, you know, again, keep it simple, sweetheart. You don't have to make everything yourself. You know, potluck, let your guests feel like they're part of the event. You know, it's nice for them to bring their own special holiday tradition meal that they make, something from their menu they can bring over, and you can order things from your favorite restaurant. You can order complete dinners from some of the specialty grocery stores and just pick them up. And you know what, if you're one of those people, and I have to admit, I'm a recovering control freak. It's not curable, it is manageable. It's manageable. But you can transfer what you pick up into your own serving pieces, and who's gonna know, you know, what they don't know won't hurt them and may make your life a whole heck of a lot easier.
Yeah,
So
I love that.
So, and you can have a cocktail party or a cookie exchange, an ornament exchange. You don't have to have a dinner party. It doesn't have to be a full-on, everything all-out event. It can just be shorter, which keeps things, you know, with an end time. And it can be as simple as, you know, just stop in for a hot cocoa.
I love this because it reminds us all that entertaining is a wonderful, wonderful, soothing thing to be able to do. To have people get together, to not isolate, to have your child exposed to other people and to their children, and that it doesn't have to break the bank, and it doesn't. You don't have to be exhausted when they get there either. I love these wonderful, wonderful, wonderful tips. So tip number 4, carrying this further.
Yes, tip number 4. This is a hard one too, because not only am I a recovering control freak, I'm also a recovering shopaholic. But it seems to me that the older and wiser that I get, the less I love to shop. I don't have time for that. And I think with the malls being crowded, especially if you don't have childcare and you have to drag your poor kids along on every shopping expedition, it's just too much peripheral noise. It's very, you know, it's just a lot for them to deal with. It's a lot for you to deal with as a parent. So I like to say, instead of picking out one special something for everyone on your list, it's a good idea to come up with one signature gift that reflects who you are as an individual and your personal style, and give that one signature gift to everybody on your list, whether it be a throw blanket or a really pretty picture frame with, you can get a picture from sometime throughout the year with the person or of the person, easy to get from Facebook. You can pull it into your iPhotos and print it out at home. Just something easy, a bottle of wine, your favorite book, and just, you know, throw some tissue paper on it and call it a day, and everybody's going to be really excited to see what you give as your signature gift next year. Now, I think that's something Oprah does. Now I've mentioned Martha and Oprah, but 2 women I admire anyways.
I love them both too. So great. If we're going to quote people, let's quote those people.
Yes.
But I think this is a wonderful idea too. It reduces your stress, but it doesn't change the fact that you're being thoughtful.
Exactly.
And really very clever. I love the idea of the picture frame, because what do you love more? Who has time always to find the picture and get it in the frame, and to give that kind of a gift is so appreciated always. Always.
Yes. I think of the holidays as being a time where, you know, the whole point is being together and creating memories.
Yes.
So when you give someone a picture frame, you're saying to them basically, I want to create memories with you.
Yeah.
I love you, and I hope that you create many, many new wonderful memories this year. And here's something you can put them in.
There you go. Absolutely great idea. Love it, love it, love it. And for the fifth one, I love this one too.
The last tip, if you have not sent out holiday cards, just don't do it.
Yeah.
You don't have to do it, because there's something amazing called New Year's cards, and you can do those just as easily in January. And there's an added benefit that your card will not be lost in a sea of other holiday cards.
Absolutely.
I, for one, am happy to let those holidays drag out for a whole nother month. When I get a card towards the end of January, nothing makes me happier.
Yes, I love this idea, and I just have to add to it. We years ago, after Jen was diagnosed with autism, I couldn't get it done. It was always a thing that hung over my head, the Christmas cards. I just couldn't get it done. And using a simple program that I found on Christmas Eve for free online, I found a way to take a bunch of pictures from the year and throw together a slideshow that was under a minute, and I sent it out to everybody on my email list. And I used the joke, and I said, you know, no trees were harmed in the making of this Christmas card. And it became our thing every year. And now it's gotten a little bit longer every year. And I even had my son do the voiceover for it a couple of years ago, but I haven't addressed a Christmas card since then. And I see people running around freaking out trying to get their Christmas cards out, and I've been able to go, I don't do that.
That's right.
And yet it's a very peaceful thing for me to sit down and go through the pictures of the year and to remember all the things that happened during the year. It's a very pleasurable, peaceful thing. I love ending the year with that.
I love it. You know, holidays really should be about just that peace, pleasure, enjoyment, joy, all the people that bring you joy in your life, togetherness. I mean, I think that sometimes people forget what the focus should be.
Yes.
And it shouldn't be about stress.
Yeah, absolutely. And these are great tips that we can use not only for the holidays, but really for this whole winter break, which I just love. I think it's absolutely remarkable, and I so enjoy you, and I'm so appreciative of you coming and sharing these things
Thank you.
with us.
I so appreciate you. And
what?
I just have a little something for you.
Is this a signature gift?
Well, yes, it's my signature gift, and I wanted you to have one. You'll be the first to receive.
Do I get to open right now?
Yes, feel free. It should be. Hopefully, it's easy to get that wrapping off.
Absolutely. I love this ribbon. How cute is that? I'm so excited. I feel terrible.
It's not a bottle of wine. You can tell.
Oh, how wonderful. And you did exactly what you said.
It took 2 seconds.
And this is a picture that you got on Facebook.
On Facebook, yes.
And it's one of my best friends got married this summer, and I was a bridesmaid in her wedding.
You look beautiful.
And so it's my friend with all of her bridesmaid, myself. This, I'm gonna cry. This is so thoughtful. And I love the frame. How beautiful is. Thank you so much.
You're very welcome. It really took no time at all. I mean, I'm admitting that, but when you do something like this, tell them you slaved. I mean, hey,
yes.
it took me forever. I had to track down 30 people to get that picture.
Oh, it's wonderful.
Believe me,
and
it's
so
a nice
thoughtful.
gift to give, I think, and
It is.
I'd be glad to receive something like that.
Absolutely. Thank you so much. How exciting. An example of using what you've given us. Absolutely wonderful. And I'm so touched. So thank you so much. We have to say again for your book, because everybody, this is a great stocking stuffer, by the way. Her book, if you get this for somebody on your list, what a wonderful thing to do. What a life-changing thing to do. So it's called FabYOUlist, and you're going to list it, live it, love it. I've got it. I've gotten it wrong.
List it, live it, love your life.
There
You're
you
right,
go.
the FabYOUlist. It also is really a good gift to give to yourself, I think, for New Year's, because it is all about setting goals and achieving them. And I think that goes right along with New Year's resolutions, which many of us make and don't keep. Guilty, but not anymore, because I have this amazing way of listing the things that you really want and actually making them a part of your life.
Wonderful. So get that, check out on Amazon and get that book. And we hope to have you back again in the new year to talk about how what people are going to do with their new lives after they've listed it.
I would love to come back. Thank you.
All right. We're going to take a short break, and we're going to be back to finish out the show, so stick with us.
So the holidays are fast approaching, and you might be looking for a fun cookie recipe you can make with your kids. Well, thankfully, Breads from Anna has given us a great sugar cookie recipe that we can make that's gluten-free. So let's get started. Here's some of the things you'll need. For the dough, you'll need 1.5 cups of vegetable shortening, 2 cups of sugar, 2 tablespoons vanilla extract, 1 tablespoon almond extract, 4 eggs, 3 cups of Breads from Anna dairy-free flour, 2 cups potato starch, 2 teaspoons baking powder, and 1 teaspoon of salt. And for the icing, you'll need 1/2 cup of shortening, 1/2 cup of butter, 1 tablespoon vanilla, 4 cups confectioner's sugar, and 2 tablespoons of almond milk. To start with, we're going to just mix together our liquids. So we've got our shortening, eggs, our vanilla, and our almond. And we're just going to go ahead and cream these together. So once that's all creamed, we're going to go ahead and add our dry ingredients, starting with our Breads from Anna flour. And we've got our potato starch, and we've got our baking powder and salt. We're also going to go ahead and put in 2 cups of sugar. All right, once that's all blended together, we're going to go ahead and cover this and chill for about an hour or overnight in your fridge. So it's been an hour, our dough should be cool. So we're going to try to roll this out to about 1/2 inch to about 3/4 inch in thickness. So while I'm rolling out the dough, I preheated the oven to 400 degrees. And I have a baking stone preheating in the oven that I'm going to set these on. But if you don't have a baking stone, that's okay. You can just use a cookie sheet with parchment paper. Now you're going to take your cutter and just cut out all your cookies. All right, so I'm gathering my cookies, my little dudes here. That's good. Let's go ahead and put these in the oven. And these should be good to go in about 6 minutes. So while our cookies are baking, we can go ahead and start making the frosting that we're gonna use once they're done. So we're gonna need our shortening. We're gonna go ahead and add our butter. We're gonna add our vanilla. We're gonna start to blend this. Okay, so once we've creamed these together, we're going to go ahead and add our sugar just a bit at a time. And last but not least, we're going to add our almond milk just to soften it up a little bit. All right, that looks pretty good. So once our cookies are done baking and we've given them time to cool, we can go ahead and frost them all. Okay, so our cookies are ready. Let's go get them. These look pretty good. Now's the part where you get to be creative with your kids. Feel free to ice these in different colors, with sprinkles, however you want. We've got our cool cookies here, our homemade icing. All right, these look great. For more of these recipes and to possibly win some of your own Breads from Anna, go to our Facebook page at facebook.com/autism-live, and we'll see you there soon. Thanks for joining me.
Welcome back to Let's Talk Autism with Shannon and Nancy. One of the things that Nancy and I had planned to talk about at the end of the show, there's a new part of the debate that rages over vaccines and autism. Ben Swan is an investigative reporter. He's an award-winning American television reporter, and he has a new program called Truth in Media. You can find it at benswann.com. com, and he's got a new report that's out on vaccines that's making the rounds on Facebook, and it might be something that you want to look at. This was featured earlier this week also in the Autism Daily Newscast, and his motto is, in his Truth in Media, is the first step about truth is to be informed. And he explores in depth on this particular video the story behind what we, the people, have taken away from the media representation about autism and the vaccines. And he asks some really important questions. He goes through in depth about the vaccine court, what that means, what that represents, and the fact that, as we've reported here on this show, there are lots of discrepancies. And the discrepancies about the fact that while on the one hand we have been told that vaccines have been proven to not play a role in autism. That's what you will hear from the media time and time again, and yet the vaccine court has settled a number of cases saying that there was an injury due to a vaccine, and in several of the cases they have reported that it was involved in an autism injury that came about because of a vaccine. So all of these things for a layperson such as myself or any other parent can be very confusing about why is this happening? Why wouldn't we know more information about this? Why isn't more information readily available? If you have questions about that and you want to know why is this debate continuing and why won't some people just let it go, what's the other side of it? I would encourage you to take a look at this report, Ben Swann, SWANN.com, and you will find out more information about that vaccine court, why it was instituted, what kinds of cases it deals with, why people are not able to sue vaccine manufacturers in a traditional court. You'll find out much more about that. In his article, he states that, and here's the direct quote, at its outset, 90% of the claims were on table. But almost 30 years later, things are very different. Today, the vaccine schedule, meaning the list of vaccines offered to children, has tripled, but the table of injuries has become more restrictive, forcing 90% of petitioners to this vaccine court into off-table litigation. And it gets worse because for families who believe that their children have been injured by vaccines, there are enormous roadblocks to overcome when seeking compensation for those injuries. And yet, some of those cases have moved forward and there has been compensation. So I do not pretend to have an answer for you. I have lots of questions. If you have questions also, I want to encourage you to check that out. It's Truth in Media, Ben Swann, SWANN.com. And, you'll find some interesting information there. So we're going to take another short break, and then we'll be back to finish out the show. Stick with us.
Hi guys, welcome back to Smarty. For December, I thought we'd work on an activity that is a handmade gift for someone who is super special in your life. It could be for a teacher, family member, or a friend. So let's get to it. The materials you'll be needing for this activity are cardstock, pencil, glue, and crayons. This activity is making a monogram letter filled with crayons. This activity is great because it works on one, the pincer grasp, and also planning ahead since you're going to be having to break the crayons to fit the inside of the letter. So to begin this activity, first things first, mom or dad or guardian is going to have to draw out the letter for the kid. If that's a little difficult for you, you can always just print something out from your computer and then glue it on the heavy cardstock, all right? I'm going to go ahead and draw mine freehand. So now that my letter M is drawn out, now it's time to fill it in with the crayons. So I'm going to take them and place them onto it accordingly and try to break them into pieces that'll fit the spaces perfectly.
See all the colors in the sky tonight.
So now that you've figured out the sizes of the crayons to fill in your letter, now take your glue and fill in the space and start laying them back in. Now we're going to let this dry for a little while. Once your monogram is done drawing, feel free to decorate any way you feel. I'm going to write a little message, but you can do whatever you want.
Stars come out and swirl around so high.
So here's my finished monogram letter. Hopefully Ms. Mackenzie is going to love her gift, and I hope you enjoy doing this activity with me. Until next time, guys, craft on. Bye.
When you see me flying by your side.
Welcome back to Let's Talk Autism with Shannon and Nancy. I mentioned earlier that our good friend Shelley Hendricks Reynolds, who is an activist and is an instrumental part and has been an instrumental part of Autism Votes and the legislation that has passed having to do with autism. She's also a beautiful writer. And Shelley has written a post that is being featured right now on the Huffington Post. It's called Getting Job Ready with Autism. And really, I was recommending that you go and read it, and I still want you to go and read it, but I wanted to talk, since we have a little bit of time, I wanted to talk a little bit more about it. And for any of us who have kids who are on the autism spectrum, regardless of what age, it's important that we start thinking about these things. As Shelley says, right now, do not pass go. And she starts the article with, recently a friend of mine asked me how old her child should be before she starts working on job readiness. My answer, now, right now, do not pass go. Take the time to stop on every single solitary square of the board, building the skills necessary for employment and an independent life so your child can collect his $200 on game day. And here is, the whole thesis for this article is get a vision, make your plan, and work your plan. And Shelley goes into great detail, and I don't want to spoil it for you because it's just a beautiful, beautiful article about how she made this happen for her young son and how he chose the place that he wanted to work. It was on his wish list, and all the things that she did to prepare him. I will tell you, though, that she estimates that over 1,500 hours were spent by his team working on getting him to the point where he was able to start his job. 1,500 hours. And he has been very successfully working at his job now for 2 years. And I think that that's a remarkable success story. And I'm always talking about how there are pioneers. I'm going to get emotional. There are pioneers who walk this path in front of us. And that it is so important that we recognize them and tell them how much we admire them and build them up for the work that they have done, and to step in their footprints so that we don't have to reinvent. And if we step in the footprints that they have left for us in the snow, we will be able to get further, which helps the next person. That if enough people step in the footprints of those early pioneers, eventually we have a road. And when we have a road, we will be able to help so many more people. So I don't know about you, but my child's 10 and a half, and I want to follow in Shelley Hendricks's footprints of how she made this happen for her son, and she details it in great in great specific detail for you on the Huffington Post right now. Again, it's Getting Job Ready with Autism, and you'll get to see a beautiful picture of her son at work. So I encourage you to go and check that out and begin to, as she says, get a vision, make your plan, and work your plan. I'm especially reminded, too, in this holiday season, I had a conversation with my 10-and-a-half-year-old the other day about where he wants to work when he's 16. And one of the things that was said to me last year that we've worked on a little bit this year is how important it is to give children responsibilities and jobs early, and that we can start by being a volunteer, and that there are so many places who could use a couple of hands, and you have to be smart about what's appropriate for your child and what place is appropriate for your child. Is your child particularly reinforced by animals, and so you want to go and have them volunteer at the local animal shelter with you working alongside them? I would never encourage you to just drop your child off and let strangers work with them as a volunteer, but maybe it's a thing you get to go and do as a family. maybe there is a nonprofit that's by you that could use help. I know that ACT Today, Autism Care and Treatment Today, last week they were doing a huge mailing, and so they needed people to stuff envelopes. That's a thing that you can take a 12-year-old child to do, and even if they only stuff 50 envelopes, there is a sense of pride that they have taken place in something, and they've alleviated some of the stress for the people in that office. And you have given them a job skill, and if you reward them appropriately afterwards, they will want to do more things like that. I mentioned that my husband this weekend is going to be being a Santa's helper at an event with a red suit, and my son has very specifically, because we've been taking him to these events over the years and he kind of gets the drill now, and this year he has asked very specifically to be one of the elves. And I'm thrilled because this is a way for him to volunteer and to be of service and understand what the expectations are, be reinforced for it, and will only help him as he gets ready to work a job, which is a very big reality, that should be a big reality for all of our kids. But again, check out this article, Getting Job Ready with Autism by Shelley Hendricks Reynolds, and you can find it on the Huffington Post. I want to take a second to talk a little bit about the rest of this week. We've got a really exciting show for you tomorrow. We've got a wonderful guest who's going to be here talking with us about fitness for our kids on the autism spectrum, and I'm really, really thrilled and excited about that. And then on Friday, we have Dr. Adele Nadowski and Dr. Jonathan Tarbox. We're going to continue to talk about consequence modifications. Last week we talked about antecedent modifications. This week we're going to talk about how we can carry through, we can set up realistic consequences for behavior. And by the way, that's for both good behavior and challenging behavior. We want to make sure that there is always a good consequence that comes with good behavior. In fact, that's the way to ensure good behavior, is by rewarding that good behavior and following through with it. So we're going to be talking about that, but we're also going to be talking about what are appropriate consequences for challenging behavior, which we're not necessarily talking about punishment. In fact, the vast majority of the times what we find to be effective is not considered punishment. So we'll be talking about that in length tomorrow and on Friday as well. And then next week, for our last week of shows before the winter break, because our last show is on the 20th, we've got some amazing stories that we're going to have for you next week, stories of hope. And one of the guests that I'm particularly excited about next Thursday, Christina Adams, who is the author of a book called A Real Boy, which was it was the life-changing book for me about autism that got us on the path to getting the help that we got. She's going to be here with us, and she's going to be talking about a couple of different things, but in particular, camel milk. Yes, I said it. We're going to talk about camel milk next Thursday with Christina Adams. She has just been a part of publishing a first study about camel milk and how that is effective with autism. So big week finishing out this week and next week. We've got some big surprises and a lot of giveaways. So make sure that you're participating in the giveaway. Don't forget that the gift for this hour was that fabulous bucket of Legos. We're going to be back tomorrow at 10 a.m. Pacific time, 1 p.m. Eastern time. Until then, please give your kiddos a hug from me. Bye-bye for now.